Hi, I'm Dr. Greg Castello with Castello Wellness with Zach from Revolution Physical Therapy, and we're going to introduce you to VO2 max testing today.
We will be using the CosMed Q NRG device this morning to test Dr. Castello's VO2 max. VO2 max is an excellent measure of health and longevity. We're measuring how well his body can take in oxygen and use it for energy during exercise. We're going to be doing a true max bike test this morning. So first data set we're going to look at is our percentage of fuel usage. We can see that at lower heart rates and lower intensities, we are going to prioritize different fuel sources over here. Lower heart rates, typically in your zone 2 range, are going to be using more fats as your fuel source. As the intensity increases, as heart rate increases, we are going to see the switch now, where fats decrease to the point of 0, and it becomes 100% carbohydrates at those high intensity levels.
So like I've talked about before, for fat burning, it's a much lower heart rate, much different than training to play soccer or run. So Zach, tell me at what heart rate I would like to be at to be maximum fat burning or losing weight with exercise.
So for that, we can jump over to our target heart rate zones. And that is going to show us a breakdown from your resting heart rate all the way up to the max that was achieved at the test. If you are trying to prioritize fat as your fuel source for exercise, you want to be exercising in this light to moderate range. All right, we're looking for about a zone 2 training. So we'd recommend in this case our patient exercises, we can use round numbers, let's say 100 to 110 is what we'd be seeking for the average heart rate over the course of about 1 hour.
So that's actually very low. If you're on the treadmill, you feel like you're not actually doing any work at that heart rate. What would my heart rate, ideal heart rate, be if I was training for sport like playing soccer or basketball or running?
Now, when you're looking for those high-intensity interval-like athletic endeavors, you want to be training more towards your zone 4 or 5. I would definitely recommend zone 5 if you can tolerate it. That'll be the most bang for your buck.
So that's 165 to 170?
Correct.
All right, so that's pretty close to max heart rate, which would be 220 minus age. So for me, that would be about 160, just using the simple math, and that actually worked out pretty accurately.
So in addition to our fitness testing, Revolution also provides a variety of physical therapy treatments and modalities. We also specialize in lifestyle medicine and weight loss control. So we are working on nutritional counseling and behavioral counseling to help supplement weight loss, all in one stop shop.
So in addition to, you have a nutritionist that you talk to?
Yes.
That goes over diet and meal planning. You have an exercise physiologist who helps you exercise. So like a trainer at the gym, but someone who actually has a degree. Mm-hmm. And then tell me about behavioral therapy. What does that involve?
So behaviors drive everything that we do here at Revolution, and we are trying to help patients dissect those behaviors, help them understand why they make the choices they make and how we can make those choices healthier. So we want to help patients find those hurdles that they're going to encounter in their day-to-day and find strategies around them. This helps patients stay on track with their nutrition and their fitness.
Great. All right, I want to thank Zach for telling me I'm old today, and thanks to Revolution for helping my patients achieve diet and weight loss goals.